Tracy. I'm a psychiatric mental health nurse practitioner student at Gonzaga University, and this is an assignment for me to introduce myself as well as my philosophy of nursing, focusing on ethics and uh, legal issues. So, I am married. Here's a picture glare of myself and my husband. We've been married for 6 years now. I am the mother of 5 children. Here they are. If I can get past the glare, you can see that they have a lot of hair, and I don't because I'm the mother of 5 children. And then I have 3 stepchildren as well with my husband. 2 of the children are still at home. One started junior high and one started high school yesterday. So I am also a grandmother of 5 and a third grandbabies. My oldest son is, his wife is 12 weeks pregnant, but here is a picture of him. Ooh, here's a picture of him and my grandbaby. And then I have also 4 grandchildren with my husband again, and they are the apple of my eyes. I wasn't really too keen when I heard I was going to be a grandma. In fact, I go by Mimi. But I've learned to love the role, even though I do feel a lot older now. So I've been a nurse for 15 years. The majority of that time has been mostly mental health, inpatient and outpatient. I've been cross-trained to med-surg, hospice, nursing home, and telemetry as well. But even when I was on those units, they knew I was a mental health nurse, and so I usually was, they came and said, hey, room 402 has a diagnosis of schizophrenia, so can you take him? And of course I did because I love them. So let's see. My philosophy as far as nursing is to help my patients help themselves. I believe that if I'm taking on or if I'm performing more than 50% of anything in the relationship, the nurse-patient relationship, if I'm doing 50% or more, or basically more than the patient, then A, it's indicative of the diagnosis, but B, the patient's not really getting anything out of it, and that's really what I'm here for. I'm here to provide resources and help them help themselves, help them make informed decisions, help them make better life choices, help them understand the medications that they're taking, and why they're taking them, and how to take them, and so that's basically my philosophy. Let's see. Oh geez. Just I don't like recording myself, and this is probably take 20 of this whole thing, so please bear with me. Take 20. So let's see. As far as my role in nursing, especially mental health, is I find myself to be an advocate for my patients because often their medical diagnoses are ignored when somebody sees that they are on medication or psychiatric, being followed by behavioral health is what we call it, the VA. And often, so for example, today, I had a patient call me, his wife actually called me, stating that he was new delirium, and he was walking into walls and on and on and on. So I told her, you know what, you need to come bring him to the hospital to rule out some kind of medical problem. Well, when they got there, the ER doctor was so focused on the mental health stuff that he could not get past that it wasn't the mental health medications or the mental health diagnosis that was causing this, that this was, he needs to be worked up medically. So it can get kind of frustrating, so I find myself advocating all the time. I also do a lot of education on the legal aspects of mental health and the fact that we can't just detain somebody because we think that they should be taking meds, or we think that they should not be out on the streets, that there's certain legal channels that we must follow to protect these patients' rights, because that's what they're entitled to, the same rights as anyone else. And if they don't want to take the meds, then they don't have to take the meds unless they're a danger to self or a danger to others, and they're detained. And even as far as medications, if they still have the right to refuse those medications unless ordered by a judge. So it's just kind of educating that we that the patients are my patients are entitled to the same ethics as anybody else, the same legal rights as anybody else. So the other thing is it's just kind of funny. I had 3 nursing students today, and one of the nursing students said, "Oh, I have to remind myself, I have that I'm not on med surg, I'm in mental health, and there's a whole new way of thinking." And within 5 minutes, I had a phone call about the guy that I just talked about, but also another guy that was complaining about shortness of breath and falling. And I'm like, what are you gonna do next? Say the word quiet. So it was really good for them to learn that we don't just treat in mental health. We don't just treat mental health disorders. We treat the whole patient. That's the medical and the mental health stuff. And the same, medical nurses don't just treat medical. They treat the mental health as well. And I think that's really the best nurse practitioners are going to be the ones that realize that you treat the best way to treat somebody is the whole person, the mental, the medical, and take it all into consideration when we treat somebody. So anyway, I hope I've hit it all. I am not really serious. I just am so relieved that I'm getting this assignment done because this is killing me. So anyway, it's nice to have you guys all in class. Hopefully we learn more about each other.